How can I differentiate between mental health myths and facts? Mental health is a topic rife with misconceptions. Many times, these myths can perpetuate stigma and misinformation. It's essential to differentiate between fact and fiction to ensure understanding and empathy. A few common myths include the belief that mental health issues signify weakness or that they can simply be snapped out of. In reality, mental health conditions are complex and often require professional intervention. By educating ourselves and others, we can promote understanding and combat stigma.
Mental health encompasses our psychological, emotional, and social well-being. According to National Alliance on Mental Illness (NAMI), 1 in every 5 adults in the US experience mental illness in a given year, and 1 in every 25 adults live with a serious mental health disorder. Similarly, the WHO estimates that globally 1 in 4 people will be affected by a mental health disorder at some point in their lives. Mental health is a process, not a destination. It's not about where you are going, but about how you drive. The barriers to mental health illness need to be identified and discussed properly so that our patients can receive support and treatment. To help our mentally ill people, we should talk about and help spread the word about mental health myths, the effects of stigma, and the benefit of open communication. The misconceptions surrounding mental health illness need to be discussed so that our community may be aware of them. According to an article by Arnold and Baker, 2018, published in the Mental Health Review Journal, descriptions of mental illness can lead to various misconceptions when teenagers have never met an individual with an illness or have no prior knowledge of illness. Community awareness of mental health increases the chance for early intervention, which can result in a fast recovery. Therefore, community awareness of mental health needs to be prioritized in order to reduce the increasing number of mental disorder victims. Mental health can now be seen as an illness, and we should not make it less important than a heart attack, high blood pressure, or cancer. On the other hand, some people believe that myths are unimportant, should not be addressed publicly, and should not waste the public funds. I understand that some people have concerns about talking publicly about mental health issues and expenses related to the programs. However, by spreading misconceptions about mental health illnesses in our community, we can bring more patients in for early treatment, save their lives, and save a lot of money on hospitalization. I want to share the story of a popular celebrity, Lady Gaga, who has been open about her struggles with mental health and has used her platform to raise awareness and reduce stigma. So, we should discuss and spread the misconceptions about mental health illness in our society to receive early support and quick recovery from mental health issues. Another important issue with mental health illnesses is social stigma. Social stigma is a significant barrier to people seeking help and treatment for mental illnesses. Additionally, stigma has been found to influence patients, families, or relatives, as well as professionals working in mental health care settings. A new study by Sabo et al., published in International Journal Mental Health Systems 2021, found that stigma also means that health professionals in psychiatric hospitals do not always treat patients with dignity and respect, and do not always make sure that patients are safe while they are in hospital. Other people urge that stigma should not be discussed as difficulties or hurdles to mental health illnesses in our community because public discussion may exhibit a negative attitude and engage in useless conversations about mental health as well as wasting of public funds. I understand that some people are concerned about the stigma of mental health illnesses, discussing it publicly, and the related cost. The campaign to remove stigma, on the other hand, seeks to raise mental health awareness. We can encourage our patients to seek treatment and aid them in recovering from their condition by discussing stigmas and barriers. If we are not conscious of mental health challenges, we might witness an increase in chronic cases and fatalities. As a result, we must address mental health stigma in order to remove barriers to receive support and treatment. Mental health experts advise taking simple steps such as attentively listening, offering support, and linking people to expert help when necessary. According to Arnold Baker, 2018, young people have an adequate understanding of mental illness and mental health. Mental health education for children and adolescents is required in schools. Other people think mental health issues are not like other diseases, so there is no need to talk to children and adolescents. A recent study conducted by Saxena, Jane Elipas, and Hausman in 2006 and published in the World Psychiatry Journal stated that patient education techniques that teach about the prognosis and management strategies to deal with chronic conditions have shown short-term beneficial effects like reductions in depressive symptoms. This highlights the significance of good emotional control and development, as well as understanding when to seek help if things go beyond normal for a certain person. So, in order to obtain therapy, our community members should have adequate knowledge of mental health issues, and mental health patients must have easy access to their psychologists, psychiatrists, social workers, and case managers. In conclusion, misconceptions, stigmas, and practical steps need to be talked about and spread in order to raise knowledge about mental health and make it easier for people to get help and advice from experts. Everyone in our society should work to make sure that mental health people have a place where they feel welcome and can get help. As we talk about mental health, we break the silence and work to make the world a place where everyone feels understood and supported. My references are Arnold J. L. and Baker C. 2018, The Role of Mental Health Nurses in Supporting Young People's Mental Health, Mental Health Review Journal 23, https://doi.org 10/11/08 MHRJ 09/2017 Saxena S. Jane Elipius E. and Hausman C. 2006, Prevention of Mental Health and Behavioral Disorders. Implications for Policy and Practice, World Psychiatry 5.1. Sobo M.A. Wati D.F. Netrida and Priscilla V. Diaz J.M. Abraham M.A. Salawa Union S. and A.L. Yetman and 2021, Types of Stigma Experienced by Patients with Mental Illnesses and Mental Health Nurses in Indonesia. A Qualitative Content Analysis, International Journal of Mental Health Systems, https://doi.org 10.1186/1303/021/0050X. Thank you very much.